Just when we thought COVID-19 was behind us, it's making headlines again. Singapore is seeing a 28% surge, Hong Kong's cases are climbing, and naturally, people in India are asking, are we next? Should we be concerned? Or is this just another seasonal spike? Let's separate the panic from facts. I'm Sandeep Sarangi and you're watching OrissaPOST Live. As of mid-May 2025, parts of Asia are once again seeing a significant uptick in COVID cases. Singapore, for instance, reported a 28% increase in infections in just 1 week, with cases jumping from 11,100 to 14,200. The cause? A new family of Omicron subvariant, mainly JN1 and its offshoots LF7 and NB1.8, which are proving to be highly transmissible. So how is India faring amidst this fresh wave? Here is the good news first. India's COVID numbers remain low. As of May 21st, the country has reported just 257 active cases. Most of these are mild, requiring no hospitalization, and no increase in deaths have been reported so far. Here is a breakdown of where these cases are concentrated. Kerala, 95 active cases. Tamil Nadu, 66 active cases. Maharashtra, 56 active cases. Other states including Karnataka, Gujarat and Delhi have only single-digit case counts. That's right, a nation of over 1.4 billion people is seeing a few hundred infections only. But this low number hasn't made health officials complacent. The Union Ministry of Health has already held high-level meetings with experts from National Centre for Disease Control (NCDC) and the Indian Council of Medical Research (ICMR) to assess the threat. Their conclusion? There is no cause for panic and the situation is well under control. However, the officials are not letting their guard down. Hospitals in major cities such as Mumbai, Chennai and Ahmedabad have been instructed to test all patients with a respiratory symptom such as COVID-19. Beds have been set aside for emergency preparedness and surveillance for influenza-like illness, and severe acute respiratory infections has been intensified. So what exactly is this new variant that is causing concern elsewhere? The main player is JN1, a subvariant of the Omicron BA2.86 lineage. It has mutated to become more infectious and better at evading immunity, though there is no evidence so far that it leads to more severe illness. In places like Singapore and Hong Kong, two JN1 and descendants LF7 and NB1.8 are driving the current spikes. These strains haven't made significant inroads to India yet, but genomic surveillance is being ramped up to track any changes quickly. Meanwhile, India is not just watching, India is ready. We already have an Omicron-specific vaccine, Gemcovac-19, developed by Genova Biopharmaceuticals. The vaccine can be scaled off rapidly if there is a need. At the moment though, the situation doesn't warrant mass immunization or new lockdown restrictions. Experts are clear, COVID-19 is now endemic. That means it is here to stay, like the flu, but it is manageable. And for the general public, especially the elderly and the immunocompromised, the advice remains simple. First, wear masks in crowded and enclosed places. Second, maintain hand hygiene. Third, avoid large gatherings if possible. It's also a good time to stay informed, avoid rumors, and trust official updates. Panic helps no one, but awareness can protect everyone. So, is there a COVID-19 crisis in India right now? The fact says no, we do not have. We are seeing a mild rise in numbers, but thanks to early detection, scientific preparedness, and public cooperation, the threat remains low. But the virus isn't going away, it is evolving. So must our awareness. Stay informed, stay safe, and don't let headlines drive fear. Until next time, take care. Don't forget to like, share, and subscribe for more such explainers on things that matter. See you next time. Bye-bye.